Hello everyone, my name is Ryan Robertson with OrthoVirginia. I'm one of the orthopedic hip and knee replacement surgeons. Today I'll be helping getting you ready for your knee video visit. First, we need to make sure you have an OrthoVirginia MyChart account. If you don't have an account, don't worry, it's easy. We'll have you go to our website, www.orthovirginia.com, to sign up. On the website, we do have great step-by-step instructions to help you through this process. But if you have any trouble, by all means, please reach out to our staff as we're here to help. Once you have an account, we'll need you to download the MyChart application onto your smartphone or tablet. Once you're set up with MyChart, we'll need to get you familiar with our Zoom software. Zoom is the platform we're using for our video visits. Overall, it's been working out great for us. You do not have to get a Zoom account, but you do need to download the software. If you're using a smartphone, which is our preferred device, or a tablet, you'll just go to the applications and download a Zoom app. If you're using a computer, you'll need to download the Zoom software. Also, you'll need to make sure that you have a video camera attached to your computer for video conferencing. When setting up your device, it is important to give access to your microphone so that we can adequately hear you, as well as giving access to your camera so that we can adequately see you. Also, when placing your video conference visit call, you need to make sure you select the internet audio selection. When getting ready for your visit, it is important to practice. The one thing we have noticed with some of our patients is they've had trouble accessing or giving activation of their microphone for hearing during the visit, or activating their camera during the visit. So preparing ahead of time can eliminate that risk. The other thing that can be very helpful with your visit is having a helper, as I do today, to manage your camera so that we can have a better access of seeing you during the visit. It's very important for me to be able to see from your hip all the way down to your knee during your visit, and a helper can help facilitate this. If you don't have a helper, it's important that you practice placing your smartphone or your computer camera in a position that allows us to adequately see you, as well as that you can then position with enough space that you can adequately complete the exam. Specifically in regards to the knee, it is important that you wear clothing that allows us to see your knee adequately in the hip, from the hip all the way down to the knee. Another thing that can be helpful with a helper is that they are able to move around during the exam. One thing specifically is being able to see from the side of your knee. That allows us to better notice your range of motion, looking at the extension as well as your flexion. It also can be helpful when getting ready for this exam to have a table or a bed that allows you to be able to lay down to further evaluate the leg range of motion, seeing you both flex up your knee, fully flexing the knee, as well as extend out your knee. This also allows us to evaluate your hip to see if you have any contracture or hip pathology that may be contributing to your knee exam. Along with it as well, we likely will have you stand up at some point so that we can evaluate your posture and how your knee is positioned, as well as then how your knee affects your gait and your motion as you're moving around. So having enough space to be able to walk some during the exam and having a helper who can help facilitate capturing that on camera will be helpful. Another thing that can be helpful is having a pen or marker to mark on your knee the actual spots where you're having pain. It's important for us to figure out whether your pain is coming from the inside, the outside, the front, or the back of your knee, as well as what positions your knee is in when you do have those pains. If we're able to do all these things during your visit, we should have a very successful video visit. Thank you so much for taking the time in advance to prepare. I wish you all the best and good luck.